every year when I come here, I really look forward to meeting you all. And I always think, as I'm getting lost in Renfrew, which I've done every year so far, that I've got nothing to tell you. And then I have things like what Sadakar's told us. I'm writing down, oh, I must remember to tell you this. So I've got things I want to try and tell you. But before I do, I want to hear, has anybody got a burning issue that they want me to make sure I cover? Right, so you're going to get my burning issues then. And some of them, I think, just follow on from what Sadakar's been saying about the evidence, and evidence-based is very big in the NHS at the moment. The evidence for prevention, which is what postural care is about, being cost-effective instead of treatment, is something that you can highlight when you've learned about the things that Sudhakar is expert in, is getting the key words to be able to say, well, this, and this will prevent, so postural care. And one of the things which I think I say every year is that you cannot assume that people with a professional hat will know more than you do, because very often they don't. And I talked about my experts by experience group at the network I was involved with, the SEN network, that it's just invaluable to be able to share information and share learning, as Sudhakar has been doing just now, to say, were you aware of these things being preventable, being avoidable, being treatable? If you don't know, how can you get the best care for yourselves and your children? And I think that's something I learned, and why I keep being involved in groups, because there's so much that, as a paediatrician, I was never taught, and I've learned from families. And I think it varies how individual people understand the importance of that. And so sometimes you can feel like you're fighting the system, when if you know a few key words, or you know someone who knows how to put it in writing to get the information or the equipment that you need, it can make a huge difference. And I'm sitting there thinking, well, couldn't they get dynamic restraint for this girl, so she didn't have to be tied down? And if nobody's tried it, then you don't know if that would have helped. And you can see that there's a conflict of how people are seeing the priority need. But I think what Sudhakar's been describing is priority hips, then chest. You know where to focus for the thing that needs to be corrected. And if you don't get the help where you are, you might know a man who does. And that's where SOFT comes in, because you can be feeding into the centre, and then they can feed it back out to different parts. Because one of the things which still amazes me is how different local authorities, different health boards can prioritise. And if the authority that you're facing hasn't got experience in the condition you're seeing, then they should be directed to someone who does. And there are potential networks that are not that easy to find. And I'm sure Sean's website will be the place to go. But to get that evidence before you approach the people for whom you need help. And one of the things that I'm very conscious about is what Sudhakar was saying about the acute hospital setting, where the equipment that you get in community, which you know is really important, is not available when you go into hospital. And sadly, the people in the hospital may not realise how important it is. So they're thinking short-term, acute, this is what we do to put things right, but then you might be weeks or months in that hospital and the situation's deteriorating. And that's where it's brilliant to know that there are ways to adapt the situation. You don't have to have your whole setup that you get in the home or in the school. You can have mouldable mattresses, mouldable pillows that can be used to prevent things getting worse in an acute situation. So I think that's where sharing the information makes so much sense, and we need each other to do that. And one of the things I was thinking about is, are you aware of the What Matters to Me and What Matters to You, which are Scottish initiatives? What Matters to, anybody heard of it, used it, seen it? Well, it's supposed to be in place for every patient in the hospital, where it was the Children's Hospital in Glasgow that started the movement, putting a notice above the bed to say what matters to me. And it might say, who's my best friend, who's my pet, who's my favourite video game. Things that mattered for me was children, but it actually has spread into adult patients as well, where the things that make you a person rather than just a number in the bed is something that's highlighted. And this is the kind of thing that could be there, but my postural care matters to me. And the postural passport is something which is an option that I think might be developed around the needs of babies, children, adults now with trisomy 1318, is what can I help you to know about my needs as a person with that condition. So patient passports are used in many different ways, and a postural care passport might fit into something like the PAMIS digital passport. I don't know if any of you have known about it, but it's an award-winning passport for people who have complex conditions to have the information that others might need about them as a person, especially important if they have difficulties with communication, so that they have a digital document that can be built up over their lifetime to ensure that their needs are communicated to other people. And PAMIS developed this years ago now, but it's now being looked at for digital transformation in the NHS, so that something that lets any person who feels that they want to communicate their needs has a way of doing that in a more comprehensive way than here's your health record, and the items on your health record are decided by the professionals when they may or may not be what you want the professionals to know about. So hopefully, if any of you haven't seen it, the PAMIS passport is really good. And the organisation, the charity, and Joanne was talking about the need for charities and third sector organisations to share things and help each other. That PAMIS has a voice at government level that seems to be listened to. So it's very much something to be aware of. And the other one, which I was just thinking about when you were describing the school, is the Scottish Commission for Learning Disabilities, SCLD. They have a big group looking at restraint reduction, and it applies to all sorts of different conditions, but it's about thinking about the impact of being restrained and how that can be distressing for the person and how it should be balanced against other needs. So just again to have the buzzwords for what you want. If you're saying, well, have you considered restraint reduction? Then it kind of makes bells ring for some other training that people might have had, and also links into the care inspectorate that was mentioned earlier about any place that someone is being looked after being set to standards, and to have good reason to deviate from those standards. So if, for instance, someone in a care setting was saying, oh, we've got to restrain because, then it has to be a better reason than just it makes our life easier. It has to be because there might be a risk of injury, there might be some other reason why this particular environment needs restraint, but it should be minimised, it should be avoided if possible, and take the preventive action wherever possible. So there are all sorts of ways to join up. And I think that the power of an organisation like SOFT is to bring together voices from families, so that you're not feeling like you're a lone voice out there saying, well, nobody's ever asked for that before. You're saying, well, I'm one of hundreds of families who have similar needs, and a solution that we know from working with other organisations, this doesn't have to happen. So you've got sort of solution to answer at the same time. So that's just thinking about what came into my head as I was there. One of my big things to ask about today from all of you is about how we can best improve communication in all its forms to and from families, not just in one direction. I've been working over this last year with a lot of groups around transition from children's to adult services, and Sudhakar mentioned that. And one of the things that we're thinking about, and we're trying a little mini project in Forth Valley where I work, or did work, is about preparing young people and their families, carers, parents, for that transition. And basically to let them know what's coming so that it's not quite such a new environment when they move. We had lots of transition clinics in paediatrics, but what I realised was that we were doing all the work we could there, but we still weren't actually looking at the reality of what an adult hospital looks like. And especially when children might have been going to a children's only hospital, for instance, in Glasgow, Edinburgh, Aberdeen, they've never set foot in the adult bit of the hospital or a separate hospital altogether if they move from a specialist centre into their district hospital. So within that, I've realised that the communications that are offered to families are sometimes not that easily used. And this is just my favourite sort of thing to quote to people. On the bottom of the letter that you get, so you're having a clinic, it will say, this information is available in alternative formats. You can have it in Braille or another language or large print or easy read. But you have to be able to read to know that it says that at the bottom of the letter. And so it's taken me a long time.
A lot of the time it actually is.
Well, before you even get there, I'm thinking, well, do we actually think about getting it right at the beginning so that then people can use the other formats? And so I'm now on a campaign about things like the signs and the information boards in the hospital, which are all in writing. And so if you have difficulty in either seeing them or reading, if you've got dyslexia, then you're going to get lost. And so one of the things I need is to hear from the people who have tried the system, what are the priorities for communicating better? Because I think it's not a deliberate thing, but it's just been allowed to happen. And I would love to see if we could improve things. So that's one of my things. Tell me what you think we need to do for better communication in, I'll just say the adult side, because I think we do a bit better in the children's. But that's something which I think is an opportunity for improvement. Another thing which, well, three more things to think about. One of them is about the rare disease collaborations, which we heard about a lot in the national meeting earlier in the year. There is a rare disease strategy for Scotland, and I've been involved in a group looking at that. One of the things which is, I think, important for you to know as a group involved with a very rare disease is that rare disease is 1 in 2,000 or less. And that's actually not that rare. So within the strategy for Scotland, there are a lot of groups with quite well-known conditions fighting for their corner as being rare. And I think it's important that, again, collaborating to raise the needs of the, well, I used to work with the exceptional healthcare needs, that is prioritised, because I think the challenges involved in the care of children with the complexity of trisomy 13, 18 and mosaic is super rare. So I think if you're interested to have an awareness that this rare disease title is becoming politically of relevance, and to be prepared to push the needs of families who have. The other key word is complexity. Suddenly it's been very trendy to talk about complexity and comorbidities, which means that you have more than one diagnosis. And the impact of coping with a child who has complex conditions is only just, I think, being fully recognised. And last time I came to talk to you, I was still involved with as clinical lead for the Network for Children with Exceptional Healthcare Needs. That my time doing that came to an end. But I was aware in doing that the criteria to be called exceptional healthcare needs actually excluded a lot of families who weren't quite in those criteria, but still very complex. And so I think now I have the freedom to say that complexity in general, when you have a lot of different conditions within one child, one person, and the number of links that you have to make with professionals and agencies is in itself a huge challenge that all of you are living with. And the more that it can be brought into a single ask, if you like, to say, I need help to cope with the complexity of my child's condition. And then whatever the details of your individual child and you as an individual family are adapted to complexity. And it's coming, but there's still a lot that we could do better. One of the big areas, I think, is back to the link between community and hospital, because a lot of the specialists that all of you are dealing with are based in a hospital, and all the clinics are based in one or more hospitals, and the communication in and out of community services may not be as good as any sensible human being would expect them to be, since we're all called the NHS. The systems don't link up. I'm thinking about the IT specialists that we depend on. Somehow they have failed to find a way to get us to actually share information. And I think, again, to be realistic, you go back to hold the information yourselves. And that's where these passports can be helpful, where you actually have the information you can give to the professionals if they don't seem to have had it from their colleagues in the other half of the health service. It seems sad that it has to be like that. It's positive in that you own the information that is yours, but sad in that it should be with the people who need to use it. So passports, I think, are good to know about the rare disease strategy, know about the postural care strategy, and know about the acknowledgement of the additional support that goes with complexity. That if you are looking at bringing together the people that are essential to your child's care, but add extra burden to you as family. And part of that is your own mental health, that to use help, we're hearing about from Joanne in terms of baby loss and bereavement, it actually applies to being the parent of a child or a young person with complex needs, that it is such a burden and it doesn't go away, so that your own mental health or self-care is something to be thinking about. And that leads me on to something that Joanne was talking about, support for fathers, and just to be aware there is a Fathers Network Scotland, which is there for the menfolk, and again it is there to support, not related to your child's diagnosis, but related to being a dad and having your own mental health needs in whatever way they can be helped. So football clubs, it doesn't have to be football, just being a man among men. And so Fathers Network Scotland is something that you might want to know about. And my next thing to ask about, and this is asking for you to tell me about it, is how you feel about your children's dental health, their teeth, their mouth, and do you have support for that if you have an interest in it? And if you're not sure, there is a dentist who is passionate about the oral health of children with disabilities, who is very keen to hear about what you think. So, over to you. What do you think? Anybody ever mentioned teeth and oral health? Do you have a dentist? Yeah, go for it.